All right, so good evening, everyone, and thank you, Madhu, for the wonderful introduction and whatever introduction you gave. बाकी सारी चीजें ठीक थी लेकिन वो हैंडसम वाला पोर्शन मुझे अच्छा लगा. Thank you very much for that. And that was the reason actually I got started on my own journey. In fact, just to tell you about myself, I'm a pediatric surgeon practicing here in Pune since last, almost 8, 9 years, and total experience of surgical is like almost 40 to 15 years. And I started on my health journey way back in 2015. Uh, and the reason I got started is because I did something called as a body fat composition. And I found myself that at the age of 35, my metabolic age was 45. I did not like it because I always wanted to be young. And that youngness should be there within me always. And that's the reason I got started. Otherwise, I was always thinking, I don't have any lifestyle diseases. What is it to worry about? Let's keep everything aside. But when I did that body fat composition, that was a trigger point, and that's the reason that I got started. And within 6 months, I lost 10 kgs. After that, I lost 6, 7 kgs more, and I've been maintaining since last so many years. Okay, and today we are going to witness the transformation of another doctor, and he's a very good friend of mine. We got connected, thankfully, about maybe a year ago or so, and it has been a very nice journey since then. And his transformation is so much inspiring. And I'm a super specialist, so I did MBBS, MS, MCH, and we are actually going to interview another super specialist. Okay, so a super specialist talking to another super specialist. Both were unhealthy at one point of time. Both transformed their health. I transformed my health. I became a wellness coach, and now it is Dr. Vinit, okay, who has transformed his health, and we'll be interviewing him. So can we have Vinit also on the stage? All right, so welcome, Dr. Vinit. I call him Vinit, but for the introduction of everybody, he's Dr. Vinit Shah, okay, and he's from Pune, and he's a very well accomplished person. In fact, when we were working together and when he transformed his health, later on I realized how much big a network that he has, how many patients he has impacted, and he's a lot of patients got connected to me, later on. So I understood that the impact which he has created in the field of liver transplantation, after he transformed his health. So instead of me introducing you, Vinit, why don't you introduce yourself about what you do and what are your educational qualifications? Can you just throw some light on that?
Thanks, Prashant, and thanks WQ community for giving me the opportunity. So I am Dr. Vinit Shah. I am basically a trained gastroenterologist, but since last 9 years, I focus only on liver diseases. And I work as a senior consultant in Ruby Hall Clinic, Pune and Pune Hospital, Pune. My work mainly involves liver diseases and liver transplantation. But what I see is a very end of the spectrum, which Dr. Prashant will later tell you as the disaster phase, where we really can't do anything. But then I started realizing that only working on patients at the disaster stage has no value. I think so. It is the stage where we work at the root cause and we try to reverse the factors is the most important thing. In spite of reading so much, seeing patients every day, still I was not at all having a seriousness about my health. I was almost 91 to 92 kg in last August, that is August 2023. My waist circumference was 108, 110 centimeters. My lifestyle was pathetic. I used to have lot of night binge eating. Zomato, Swiggy was my day to go every day. After a very bad day, I thought eating pav bhaji or eating something at night will be the best stress buster watching TV. But somehow, maybe one fine early morning, I somehow got up and just scrolled the Facebook and then came across Prashant. And maybe it was like you call that early morning is the Brahma Muhurat. So that 4 to 5 o'clock Facebook post of Prashant served as a Brahma Muhurat for me. And I did not waste any time. I just connected to him the same day. And after that, it has just been one of the most amazing achievements of my life. Means I am not happy even after I have won two gold medals. So I have won one gold medal for my medicine for all over India from Ministry of Health and Family Welfare. I've also won a gold medal for gastroenterology from Ministry of Health and Family Welfare. But I was never happy more winning those gold medals. Also, the more happiness I am getting now after losing almost 20 kgs and almost losing 25 centimeters of my waist circumference. The happiness which I get is unparalleled. So I think all credit to Prashant sir and the WQ community for making me get the true happiness in my life. I thank you all.
100%, 100%, Vinny. That is amazing. And I know, when we had the first interaction and we had so much detailed discussion about your health, and it was surprising that you have been dealing with patients whose liver has been completely damaged, who has reached a stage of cirrhosis, and then they are actually entering into liver transplantation. So, विनीत थोड़ा सा बता सकते हो क्या कि बिफोर वी गॉट स्टार्टेड तुम्हारे चैलेंजेस क्या थे व्हाट प्रॉब्लम्स डिड यू फेस थोड़ा सा इलैबोरेट करके बताना ओके एंड आई वुड आल्सो लाइक टू टच बेस अपॉन because you are a liver specialist. I would also like you to touch base upon the fatty liver aspect as well.
So see, I always knew means my life is very unhealthy. Actually, my main intention of going into liver diseases was Prashant knows very well. My father suffered from liver cirrhosis. He developed liver cirrhosis, leading to need for liver transplantation. Unfortunately, 4 days after the liver transplantation surgery, he got a crippling stroke and he is bedridden since 2017. My real uncle also succumbed because of liver cirrhosis. And in both of them, the etiology was non-alcoholic fatty liver disease, which was entirely attributable to obesity, dyslipidemia, metabolic syndrome. So I knew those family traits were present. I was becoming obese. I was having a high cholesterol whenever I did the lipid profile. But somehow, in spite of having so much seriousness about the family members, seeing patients day in and day out, that motivation that I have to transform myself never came in me. It used to be maybe 15, 20 days of intermittent fasting, 1 month of eating fruits or salads. These were the some things which I did. Sometimes following there is a big fad in Maharashtra known as Dikshit diet, where you eat only 2 times in a day and you can eat whatever you want. So that I did, but somehow all the things were short lasting because they were not able to be made a lifestyle. And mainly, I wanted somebody who will understand the life of a doctor, the challenges of the doctor, what lifestyle he has. So, when I read Prashant's post about him mainly working on doctors, I thought maybe let's give it a try because he himself, being a super specialist, he will understand those challenges and maybe I can get the lifestyle which is required for a successful transformation. So I think so. It all started from there, and it has just been a positive, steep upward curve from there for me.
100%, and we'll definitely talk about it because your gold medal achievement is one thing, and the things you are achieving now is a totally different ball game, and we'll talk about that also. But I want to ask you, Vineet, that it was about a year back that you got started, correct?
Yeah, August 2023.
August 2023. So, can you just elaborate a little bit more on what all things have got transformed in your life since the time you got started with the program?
So, if I have to answer in maybe 2 or 3 words, I have become a very better human being. I think so. See, weight loss, achieving inch loss, achieving waist circumference, these are all the parallel achievements which you are going to have. But like now, you feel that the lifestyle I am living is such an exciting lifestyle where means even if one day I don't work out, I feel incomplete. If one day I don't eat salads in my diet, I feel incomplete. If I don't sleep on time, I feel that there is something going wrong. If I don't do meditation one day, I feel that something is incomplete. And all this together has made me a better human being. My approach towards my family members, my approach towards my patients, the impact which my body language has on my patients, and the positivity which helps me do much better in my work. I think so. All that is the best benefit of this transformation. Naturally, weight loss, inch loss, all these things are there, but I think so. The number game is not important for me. I think so. Now I have got a lifestyle which I can follow till my last breath. I think so. That is the most important achievement of this transformation.
Amazing, Vinny. That is incredible. And you have been one of the most sincerest, persons, I mean, one of the most sincerest client, I had. And so I think you have transformed yourself. You lost around 14, 15 kgs about 8 months back. And then, it is
It's
like you
still
have been able.
having a, yeah, I'm now close to 19 to 20 kg, and the circumference loss is also from 108, 109. I have come down to around 85, 86 centimeters waist circumference.
Correct. And this is, amazing. In fact, when I saw your recent pictures, I could clearly see that, it's a very little bit of belly fat which is remaining, and the kind of belly fat which you had earlier is so different. Not only that, but I want to tell you that when I got connected with your patients, okay, later on when we had the discussion, one thing which I noticed very is, it was very startling, and probably you might have noticed is that a lot of your patients said, डॉक्टर विनीत के साथ हम लोग आसानी से बात नहीं कर सकते हैं. कौन सी बात पे गुस्सा आएगा मालूम नहीं. ठीक है. एंड हाउ इज इट नाउ विनीत, आफ्टर सो मेनी मंथ्स?
So, means definitely it has significantly changed. My composure, my calmness, my ability to let go the things, my ability to adapt, accept the people as they are has definitely changed in last 1.5 year. Uh, I would also like to tell that I have been able to bring about a big change in my doctors community because we all have lunch together. And I think so, 1.5 year back, maybe salads in everybody's doctor's tiffins were never to be seen, or maybe ek do kakdi ke pieces, ek do tomato ke pieces. But means I think so. Everybody at least acknowledge that Vinith, after seeing you, everybody consciously has started bringing salads, and at least a significant portion of their tiffin is now salads. So I think so. My transformation has at least been able to ignite a change in my surrounding people. That's all very important thing which I would like to tell.
That is amazing, Vineet, because what happens usually is that if there are 4 5 people, who are sitting together, और उसमें से 5 ने सैलेड नहीं लिया और एक ने सैलेड लाया है, तो चांसेस ये है कि जिसने सैलेड लाया है वो ही स्टार्ट फॉलोइंग दोस अदर 4. बट यू मेड ऑपोजिट डिफरेंस, लाइक
Yeah, that is definitely there.
That's incredible. But one thing which I would like to point out, and this is for everybody. See, Vineet is a hepatologist and he has an extremely busy schedule. Okay. In fact, he has been to Hyderabad today. He had caught a flight. He had come here. Okay. He attended his OPD, and after OPD, he is coming for this, interview. All right. So it's not that he's having a lot of time. Okay. He has a very, very busy schedule. So, Vineet, I want you to highlight, because there are a lot of people who give this excuse, oh, I don't have time, मेरे पास टाइम ही नहीं है, ऑलरेडी मेरा पूरा दिन ऑक्यूपाइड रहता है, या फिर अभी सही टाइम नहीं है, अगले when I'll have some time then I'll do it, and all sorts of excuses. So, Vineet, how did you manage your time, and how you were able to conquer this time factor?
So I think so. I also used to procrastinate a lot. Maybe exercise अभी नहीं करेंगे, खाना अभी नहीं, पहले पेशेंट्स देख लेंगे, खाना 3 4 बजे खाएंगे, कभी कभी शाम को 5 बजे खाएंगे, काम खत्म करके रात का खाना 9 10 बजे खाएंगे. But I think so. This transformation has taught me that if you are good in your work and if you are healthy, I think so your work is only going to grow. So now come what may, means I basically give 1 hour 45 minutes or 1.5 hour every day morning to myself after I get up. I start with a small meditation, then I do my 45 minutes workout, and then I do my 30 minutes meditation. So I think so. I have made my patients understand very clearly that between 6:30 to 8 o'clock, I would not like to get disturbed, and I think so. My patients have also understood that, and it has not impacted my practice in even 1% amount. The other thing was about not eating on time. कि patients OPD से निकल जाएगा, your OPD practice will become less. You will get less number of patients to see. But once you make it clear that maybe between 1:30 to 2:30 I am going to have lunch, and I am going to complete my dinner by between 6 to 7, and then only I am going to see my OPD. Patients understand that, and I think so this discipline has made me really transform myself well, and the patients also understand and they give more importance to this, that the doctor is so disciplined, so we have to follow him more seriously. I think so if the doctor is not serious about his health, how much ever you practice, they will, how much ever you preach, they are no, the patients will never practice. They will tell ये खुद ही इतना मोटा है, ये खुद ही ये सब खाते रहता है, ये खुद ही टाइम पे नहीं करता है, तो ये हमको क्या सिखा सकता है कि ये खाना चाहिए, ये नहीं खाना चाहिए. सो I think so that discipline has to be brought, and maybe it is maybe 60 to 60 days or 75 days, 2 to 2.5 months. If you cross that barrier of 2 to 2.5 months, then this lifestyle, like Prashant sir tells in his lectures, वो लड्डू चख लिया तो वो लड्डू इतना मीठा होता है कि मीन्स यू नेवर वांट टू लीव दैट लड्डू, सो यू डोंट वांट दिस लाइफस्टाइल टू गो. आई थिंक सो नाउ इट हैज हैपेंड लाइक दैट द laddu is so sweet that now I just don't want to give away the laddu by compromising even something on my lifestyle. And it has really amalgamated very well with my practice. And I think so it has not impacted my practice in any which way.
100%. In fact, through Vineet, there are three doctors who got started, okay, from Rubion, and one of them has already transformed. Another has lost about 8.5 kgs so far. Another has lost around 8-9 kgs so far. So Vineet, the kind of impact which you have created is just amazing. Tell me something about this is the cream. It's like what compliments you have got so far, and how it is impacting in your gastroenterology conferences, the kind of interviews that you have conducted for Times of India. Can you just throw some light on that?
So I will tell you the compliments of last 2 days only, because it is our annual liver transplant conference. So we get people from all over India. So there have been some people who have met me 5 years back. There have been some people who have met me 4 years back. So like at least 90 to 95% of the people could not recognize me. They told Vinith, you are looking younger by at least 7 to 8 years. Other people told Vinith, means, are you planning to get married again? Because I think so. That was the one compliment. And means patients, at least on an average, if I'm seeing 15 to 20 patients, at least 10 patients are such that who come for follow up after 4 months, 5 months. So they just are too much impressed, and they tell Vinith, sir, we are not able to recognize you. What are you doing? So I think so the compliments which you get boost you more, that means ये lifestyle को अभी जाने नहीं देना है at any cost. So it has been really very excellent experience, the compliments I have got.
Amazing. One very important point, Vineet, which I want you to highlight is about investments in health. Okay. So बहुत सारे लोगों का ऐसा है कि प्यास लगा तो कुआं खोदने का, ठीक है, एंड दे स्टार्ट इन्वेस्टिंग इन देयर हेल्थ एट द लास्ट मोमेंट. ओके, इट्स लाइक ये दे आर डिटेक्टेड विद डायबिटीज, they are detected with hypertension or hypercholesterolemia or heart attack or some knee issues and all that. Okay, and then they start investing, and usually we know from being from medical fraternity that the investment is in probably major thousands or probably in lakhs of rupees. Okay, and you had also experienced in your own father's case that how much is the kind of investment that you have made for your own father. Okay, so regarding investment, okay, there is an investment in prevention, there is an investment in treatment. What would you recommend, and why would you recommend the investment in prevention? Can you throw some light on?
So I think so means it is a no-brainer that the investment has to be in prevention, because investment in treatment is only like patchwork. Like you get a liver disease patient, he gets serious, you admit him to the ICU, the patient spends almost lakhs of rupees over even a week's admission, and you know that it is not going to reverse. He is again going to have a bad complication of liver disease until he gets liver transplantation. Now, even if you do liver transplantation, it is liver transplant is like giving one more disease to the patient. It is the disease of immunosuppression. You become on tablets which are going to reduce your immunity. Those are the tablets which tremendously increase the risk of tumors, Those are the tablets which tremendously increase the risk of cancers, heart disease, diabetes. And you are always having a hanging score that something may go wrong with me, something may happen to me. As against that, prevention is like compound interest. Means once you improve, it is just going to keep on multiplying, and it is not a patchwork. It is going to stay with you for life. And I think so the quantum of investment in prevention is minuscule as compared to the minuscule means it is really minuscule, means it may not be the nail of a finger of also, as
Correct.
compared to the quantum of investment on treatment, means you just can't compare. So means I will be bold enough to tell that at least 5% of your income monthly you have to spend on your own health. I will be very, means you invest less in equities and mutual funds, but you invest more in your health. 5% of your monthly income you should invest in your health. It may be, and it should be towards prevention only.
Correct. And that is coming from a Shah, okay, who's a Gujarati, okay. And you know how Gujaratis are business minded, and still, he's talking about 5% investment in your health. Okay. One point which I want to really highlight, because you are into liver transplants. In my When I was doing surgery at that time, there's a lot of patients, and even I see today, who are with grade 1 fatty liver or grade 2 fatty liver. Okay. And I used to think grade 1 fatty liver, it's okay, it's a normal thing. Okay, so I'm sure there might be a lot of people who might be having grade 1 fatty liver or grade 2 fatty liver. Can you just throw some light on what are the implications if we don't do, the consequences of inaction, and how we can actually prevent or reverse it?
So see, the fatty liver disease in India, unfortunately, we Indians have a what lot of tendency towards fat in our belly. We have central obesity. So with that, we are the diabetes capital of the world. And we have a very high disease of liver disease prevalence of fatty liver. It is to the tune of 50 to 70%. So that's why if you see, you do the ultrasound of 10 people, 7 will have fatty liver. I don't think so. Fatty liver should be taken lightly because it is not a normal finding. Fatty liver means your liver cells are getting damaged, and it is a completely reversible condition up to a particular stage. So I think so. This lifestyle modification, 6 pillars of your life: diet, exercise, sleep, mind relaxation, keeping the home environment nice, being a part of a excellent community like WQ community. This is the right step towards targeting the fatty liver because you can treat it at the root cause. And the added benefits are, if you treat fatty liver with this lifestyle, same is the treatment for your cholesterol problem, same is the treatment for your diabetes, same is the treatment for your thyroid, and same is the treatment for your hypertension. So I think so if you treat fatty liver, you get a complete comprehensive control over all these associated metabolic syndrome complications. And I think so you can have a better longevity because if the fatty liver progresses, that means if your liver becomes harder, which is known as fibrosis, in short scarring of the liver, then beyond a particular stage, the scarring of the liver cannot be reduced even by weight loss. And once the scarring of the liver happens and the liver cells start failing, then you get liver cirrhosis, liver cancers, at which it is the disaster phase and where this lifestyle modification measures will not help you. So I think so fatty liver is like an maybe the alarm bell which should ring in your ears, and you should use these 6 pillars of health and try to reverse it at that stage itself.
Amazing, Vineet. We can go on and on. And just one last question to you. What is the final message that you would like to give to this crowd? We have almost 724 people, okay, logged in. So what will be your final message?
So I think so. The final message is number one, actively invest in your health, both financially as well as time wise. You have to give time to your health. 1 to 1.5 hour of time is the your right, and you should use it for your health. Your job will continue, your career will continue, but if you lose your health, it will not come back. And no amount of money can buy good health. That is one of the asset which you have to earn with your lifestyle only. No money can buy health for you. So you have to give time to your good health, and I think so. Good communities like WQ are around, which are there to help you. The challenges which they run, the weekly challenges like the gut health challenge, the hormonal health challenge, all are excellent 5 day challenges which really stimulate you towards this healthy lifestyle. You should go to this healthy lifestyle so that you treat at the root cause and you don't allow the disease to go to a disaster stage and an irreversible stage.
Incredible, story, Vineet. It is so inspiring, and I'm sure you have impacted not only 724 lives, but these people are going to talk to their family members, their friends, and probably, as you know, if this comes on, social media, this recording, then I don't know how many people are going to get impacted. Thank you so much for finding time from your busy schedule and coming here, and thank you so much, WQ community, for allowing me to host this wonderful transformation.
Thanks, Prashant. Thank WQ community. Yeah.